feel you need a bag, like some people make like a perfect bag, it's up to you. I just put it there as my dirties, okay?
And you don't have any gloves on at this time?
No gloves,
The
yeah.
gloves are in the thing.
Right,
Right.
I wanna use these, but once I get there, I'll tell you what I do. So we're gonna open, okay? That just falls open, and these are usually tabbed like that, and then lastly goes forward, right? So now I have a sterile field. This is hated. You may use it or not, it's cumbersome. I'm gonna show you why, okay? It's perfect now,
But it gets
right? But then I come in and maybe her vagina's down lower, and so half of it is covered. So for me, I don't like this.
So you don't have to?
You don't have to, you could use it like this, you know, fold
Okay.
it in half. All right, whatever you wanna do. Okay, now your gloves would be here typically.
First you have to put gloves.
Huh?
First you have to put gloves and then.
Yeah, so what I do, the gloves would have been probably next.
Mhm.
What
So,
about cleaning her?
we're gonna do that, we're gonna have sterile first.
No, I mean like as far as like just like a regular cloth. Do you do any of that type of?
No, mm-mm.
Okay.
No. I mean, you could do pericare. I mean, yeah, she had a ton of mucus because she's laboring. You might do pericare first, but it's not sterile. And then you would just use the chucks to wipe down the blood and get it clean chucks.
Okay.
Right? You could do that if you saw a lot of visual blood there. That's not a problem at all. But usually they're getting a Foley earlier, like for a C-section or for anesthesia, so they might be 2 or 3 centimeters and you're not gonna have a lot of blood. But yes, of course, if there is, you can clean it up. So for me, I like the bedside table to put my gloves on in this situation. So I would have pulled the bedside table close and let's pretend that I have that, right? And so then I would just open my gloves. Now, I've seen you all put gloves on, not all of you here, but other rotations, and some of you do it great, and some of you really suck, okay? So, always remember it's pinch, 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 scoop, okay? I'm right-handed, so I always go for the right glove. That's just the way I do it. I would take gloves and figure this out at home. Because the one way, one of my students last semester, he lost the whole procedure because he couldn't put his gloves on. Okay, and he had big hands, and then he was sweating, and the anxiety went, and then he really was sweating, and it was like I'm like, oh gosh. So I had to like work with him for like an hour, and I think it was more nerves, but once his hands got really sweaty. So, before you go to put your gloves on, if you're a sweater, right, on your legs, because you're putting sterile gloves on, right? So just dry them off. Okay, I'm putting gloves on, right? Okay, so now I'm pinching, right? Pinching. Right thumb out, thumb out. Do you see the thumb out? Okay, so I know that this is right, okay? I mean, I'm
Left.
taking the right, but it's left, right?
Oh.
Yeah, I'm taking with my right, but it's left. See how easy that went on? Okay, this one is scoop. Do you understand what I'm saying?
Mhm.
Okay, scoop. Hand in. Okay, say this happens,
I do that all.
Your right hand
Okay.
can fix it.
Yeah.
Your left hand can fix it.
right? What is this universal sign of?
Sterile.
I'm
Sterile.
sterile. Okay, I'm sterile. Okay, or this, I used to do this when I would scrub in the OR, and I'd be like in my gown, and I'd stand there. Because when I hold my hands together, I remind myself, don't touch anything.
Right.
And it's almost like I'm like, okay, calm down, girl, don't touch anything. All right, you got this, and I walk around the room. It's also telling you, hey, can you get me, blah, 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 and you're like, oh, you're sterile, okay, right? So you stay away from me. Okay, so once I have this on, and I know I'm sterile, I'm gonna place this little pad underneath the butt, okay? Now, because this is sterile, my hands are sterile, I cover up like this. Because the back, do you see? The back is waterproof, and it doesn't matter, really, right? And I just kinda go like that.
Just kind of drop it.
Right, and this part over here might have touched my arm, but this is outside, still sterile here, right? So you kind of do this quick, and you just drop it.
So once you drop it, don't touch it
Don't
again.
touch it,
That side.
right?
Okay.
And then we have another one of these. We didn't need to, they put the stuff away. Okay, once I get to this point,
Can't touch it.
yeah, I could do this, like if it
Oh,
bothered
okay.
me.
Oh, you
It
can?
bothers me, yeah, because I'm sterile.
I know a lot of us are.
And this is sterile,
Okay.
right? Once I put that down, I probably wouldn't touch it, because I can't be sure that the patient didn't touch it when I turned away. So I probably wouldn't really try to touch that much
But if you
afterwards.
drop that.
And plus, anyways, once I touch here, my left hand's dirty anyways,
Yeah.
okay?
So that's when you see
So,
it.
then I come here, so I've set up that, I've got my gloves on, I got my trash ready, right? So then I open these up, and these are, oh, this is just liquid. So I open this up, right?
All over the car.
Okay, there we go. Open this up. Okay, there we go.
Is that the lubricant?
Okay,
Yeah.
yeah, okay, my water.
Shouldn't be too fluid.
All right, so I hold this up now. I've done this, this has betadine on it. I've done my lubrication. I've undone my little cover for this, and then I go like this. Okay, and I can move this now if I want to, right, as long as I'm keeping my hands in. So I get this out, right? Trash. I curl it up in my hand. I just kind of move this slightly. I go here for my water, and I connect it. Okay? Oopsie. That's what you're trying to
Don't
avoid
let
by
that
holding
flow
it,
around.
right? Don't let that flow around. Into my lubrication,
Mhm.
back in the box.
Okay.
Now I'm water and lubricated. Oopsie, box is broken. Okay, back here. Okay, dip my hand in a little lube, right? Okay, hands into kind of the introitus area, and then pulling back like this, okay? Now I don't move, so you kind of put your hands in below the urethra, and then as you're pulling back this, okay? Some people, I like to kind of go like this if they're heavy, because you have more stability with your thumb. But really, if they're thin, you can do this very easily and you can see it. So it's up to you. So in and up, pull it out. Okay, there we go. Now, I think I see it, but I just want to confirm. Yep, that's it. Okay, because it goes like this. Hey, on the urethra. Okay, that's what it does. Watch. It goes, yep, it's me. Okay, it winks at you. Okay, yes, because it's a valve.
So
Okay, so when
So
you
when you're
pull
It
it
opens back
down,
up.
it goes, the valve comes down, and when you let go, it goes, and it opens, okay? So it's like, you got it. Okay. So we do 3 of them,
and it's
okay?
left, right, middle.
I mean, don't worry about it, really,
Okay.
seriously.
Just
really.
trying to remember my training.
Yeah, you're right. Technically, when you get on the floor, it's gonna be white, 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 right? You can go inner, outer. Some people have labia so small that each wipe will go both sides of the labia and the middle. And remember, you're pulling it apart. So you're just kind of, I mean, you could go left, right, down the center, and then you're in. You're right, you're correct on the training part, but watch what people do.
So once you touch that, don't touch anything with that.
Right,
Oh, yeah,
that's
with
it,
that
my
hand.
hand's there.
Sorry.
Okay, it stays there. I know where I'm going. I know what's happening. So now I get rid of this too.
Slippery.
Okay.
It's hard to hold it open.
Yeah.
But some people, it's very anterior,
Okay.
and for heavy people, it's very posterior,
That's why it's more
internal.
difficult.
That's why it's really
Okay.
difficult. If somebody's very heavy, you would have a student or me be holding this labia back and holding that labia back,
Oh, okay.
which is
Dang.
so awful,
I
huh?
know.
Dang.
Yeah.
It's really
Embarrassing.
awful, embarrassing. Okay, so for now, when I'm to this point, I've gotten rid of everything, I've prepped, I'm holding, I know where I'm going, I pick the whole box up. Bam, right? I'm still sterile. And I'm not dragging, right? And then the thing gets caught here, and I'm like, can you undo me? You know what I mean? You're just right here, okay? I'm already lubed, I know where I'm going. Okay, little poke, okay, and she'll go, and then you get in and it's over, you know? Okay, we're in. Now, with a pregnancy, if she's having a contraction, this will start to come out, right? So if she starts contracting and you see this moving, just hold it in until the contraction's over, okay? You can hold it in just there until the contraction's over. Once the contraction's over, it's not gonna push it out, okay? Put your water in. See, it's not going in, but whatever. Now, once the water's all in, I climb up the syringe. Why do I not use this hand? Because
Because
this is a
it's
dirty
dirty.
hand. I don't want to touch this, and then this is contaminated,
Yeah.
right? I climb up, and I disconnect. Okay. Disconnect. All right, there we go. All righty. So, can I put the Foley like this? Can I do this?
No.
Very good. You already know that, right? I have to go over the leg like this. Now, the Foley kits at Tarzana have like a pad that goes here that has a swing on it. So that when she moves, It's not pulling this all the time,
Uh,
okay? So when she moves, it kind of goes back and forth and gives mobility in this. So we'll show you how to do that. And then this should be just below the leg on the bed, here. Okay?